As the nursing strike at Providence Health passes the 1-month mark, dozens of workers gathered at the state capitol today in support of a strike-related bill.
It would require hospitals to report the money spent on replacement workers. Katu's Vasily Varlamos reports.
The Oregon Nurses Association organizing a group to testify publicly at the Oregon State Capitol in support of a bill requiring hospitals to report the money spent to recruit, advertise, and pay individuals replacing employees on strike. The bill would make hospitals provide a report every 30 days during the strike and would provide a final report within 30 days of the end of the strike. The reports would be sent to the Bureau of Labor and Industries and the Oregon Health Authority.
I feel like there's a lot of misinformation that's being disseminated from the top down on how much money is available. I think by accomplishing this, we get the actual numbers and figures, and so we can tell who's telling the truth and who's lying.
Nurses want this information to prove that hospitals are able to pay workers the compensation they're asking for. This comes after nurses at 7 Providence hospitals rejected Providence Health's latest offer to end a now month-long strike on Friday. In a statement regarding the bill, Providence says to ensure operations can continue during a strike, hospitals through an agency to recruit temporary workforce needed to continue providing patient care safely. Without temporary replacement nurses, Oregon would have a significant public health crisis anytime nurses choose to strike. Coming up at 6, I'll share what happened inside the public hearing with more perspective from nurses.
Republicans are calling for what they say is a modernization of the sanctuary state law.
Today, House Republicans unveiled legislation that would make changes to the current law. In a statement, they said that the House bill would let local law enforcement agencies work with the federal government to remove people convicted of Class A misdemeanors or violent and sexual felonies. In Oregon, Class A misdemeanors include things like breaking into a car, initiating a false report, or carrying something that's considered a burglary tool. This comes after President Trump signed an executive order instructing DOJ staff to investigate and prosecute state and local officials in sanctuary jurisdictions who do not actively assist in immigration enforcement. In recent weeks, Governor Tina Kotek has said she will uphold sanctuary laws, and Portland has joined other sanctuary cities in a lawsuit against the Trump administration. We reached out to state Democrats for a reaction to the new legislation. We'll let you know when we do hear back on that.
As the nursing strike at Providence Health passes the 1-month mark, today dozens of workers gathered at the state capitol in support of the strike-related bill.
It would require hospitals to report the money spent on replacement workers. K2's Vasily Varlamos reports.
The Oregon Nurses Association organizing a group to testify publicly in support of a bill requiring hospitals to report the money spent to recruit, advertise, and pay individuals replacing employees on strike.
Hospitals often claim financial constraints while continuing to receive substantial public funding from the legislature. Yet, when our frontline workers go on strike, hospitals then turn around and spend significant sums on temporary staff to fill those gaps.
Nurses want the information to prove that hospitals are able to pay workers the compensation they're asking for. This comes after nurses at 7 Providence hospitals rejected Providence Health's latest offer to end a now month-long strike on Friday. Kathy Keene, chair of the bargain unit at Providence St. Vincent's, says hospitals often spend millions of dollars on replacement workers, but those payments remain undisclosed.
This lack of transparency means that Oregonians, whose tax dollars help fund these hospitals, have no way of knowing how much their money is being spent to undermine frontline healthcare workers rather than invest in patient care.
Sean Comer with the Hospital Association of Oregon says this bill will not accomplish much for the medical staff and sees it more as a bargaining chip.
There's transparency in hospital financials, in current reporting. We've had other bills and other conversations around transparency. This bill doesn't accomplish that. This is a negotiating tool, and frankly, we'd rather have that happen at the local level.
I'll keep you updated on the status of this bill in Salem. Vasily Varlamos.
And as we mentioned, today's protest comes as thousands of Providence nurses remain on strike. The nurses on Friday rejected a contract offer from Providence. Unions said the offer did not go far enough to address long-standing issues. Hospitalists striking at Providence St. Vincent approved their offer. However, they said they would honor the picket line until nurses reach an agreement with Providence. Providence says their bargaining teams are considering next steps and are working with the federal mediators to determine the appropriate time to return to bargaining.